Preliminary study. Association among increased inadequate type of food ingestion, decreased memory and reasoning performance in students initiating graduation, and higher symptoms of anxiety, depression, stress during first and second waves of COVID-19. Psychological alterations are one important effect of first and second waves of COVID-19 associated with increased eating and sleeping habits. Literature indicates that during pandemic context, the population has been more affected by psychological consequences than the disease itself, and that depression, anxiety, and stress are related to pro-inflammatory state linked with prediabetes or metabolic syndrome. More sweets, processed, embedded food might possibly be consumed during the pandemic and are linked with pro-inflammatory state. Some foods due to chemical preservatives conduct to weight gain that produce also a pro-inflammatory state and as a result could promote or can promote depression and anxiety, at least in slight dimensions. It is a cross-sectional study with a sample composed by 80 students initiating graduation from a universe of 240 students ranging from 18 to 21 years old. Online instruments were used to collect data. EADS test to measure depression, anxiety, and stress, and a closed questionnaire with items regarding habits and feelings during COVID-19 pandemic. Fisher test, chi-square test, and logistic regression test were applied to statistical analysis. Results and discussion. In this sample, depression and anxiety were strongly related to increased sleeping hours during first and second COVID-19 waves. Higher anxiety symptoms were related to processed food ingestion 5 times or more per week, and emergency remote education too. This type of food has been related to higher presence of chemical preservatives. If symptoms of depression were at moderate to excessive levels, there were correlation with eating fried foods 3 to 5 times or more per week, which has been linked with saturated fat. Moderate and severe stress symptoms were associated with increased food intake at first and second waves and were related to sweets ingestion 4 times per week or more and difficulties with memory. Stress also was related to embedded food intake 5 times or more per week. Literature in experimental studies which induced saturated fat ingestion cause obesity and effects linked with depression. Continuous pro-inflammatory state causes risk factors that were not studied here. COVID-19 pandemic promoted negative feelings in the sample, probably due to uncertainties with SARS-CoV-2 and social isolation, associated with increased psychological effects as higher symptoms of depression, anxiety, and stress, related with increased sleeping and food intake. Inadequate foods contribute to pro-inflammatory state, are largely associated to depression and anxiety in literature, then could be also related to such results. Certain types of food were related with specific psychological symptoms in this study that could not be causal effects of inadequate food ingestion. Alterations in immunity brain cells induced by pro-inflammatory state have been linked in literature with psychological symptoms, memory, and reasoning difficulties. Then, probably, they were related to such results.